And that's it. Final curing is done. Now we're going to go straight to finishing Sue's case here. And she has been a great patient. Are you doing all right, Sue?
Mm-hmm.
Okay, great. Suction in there just a little bit. Now we're going to go to cleaning off some of this resin cement. And here's where I'm going to change to magnification here. And I will tell you that magnification is such an incredibly important part of this whole procedure, precisely now with the finishing. A lot of times with magnification, I won't use it as I'm placing the veneers because I'd like to see the whole case, so I like my normal vision. But now, magnification in terms of finishing makes the whole case. And those of you who have been using 2.5, I'd highly recommend going to 4.0 magnification in a lot of instances because you can really see it a lot better. Let me show you what we're going to use to finish, and this is called the Lumineer finishing kit. And so we, over the years, we've always recommended different kinds of kits, but this one is made really to fit with the porcelain. And again, it's a whole system, and these are the different burrs that we're going to go ahead and use as we go and finish this whole case. Finishing is what makes these cases. And now what we're going to do is literally just blend the porcelain right into the enamel. And I always try to describe this to dentists as we're going to now marginate and almost create the margin after the fact as opposed to before the fact. Because if you think about what we have right now, we've got luminaires cemented to the enamel, but at the edge of all the luminaires there's this little hump, this little shoulder, which we are literally going to feather edge right into the enamel. So that when you take an Explorer across, you will not find any margin on these things at all. It will be a smooth transition, and that's really what we're looking for. You can't do that with any other ceramic that's now on the market or with any other kind of veneer. So that is really what makes this whole system so unique. And I like to use the term blending, which again I learned from Dr. Robert Ibsen. That's a really nice term to think of what we're going to do now. We're going to blend the porcelain into the enamel. You can't do that with other porcelains because when they get that thin, they'll start to chip and they'll start to crack, and you'll see this. So I'm not worried at all in terms of her case of putting pressure on these veneers at this point in time. We are going to really, this is the ultimate to me in biomimetics, and anybody that's read Pascal Magnier's works on biomechanics and biomimetics can really appreciate this. This is really the ultimate in terms of biomimetics because now this Lumineer is really like one with the enamel, and I'm going to treat it as such as we do the occlusion and as we do the finishing. So let's begin here. What I'm going to use first is this 12-fluted burr, carbide burr, which just about every dentist knows. And I'm just literally going to go around the veneers a little bit just to get off some of the Ultrabond cement on the veneers and a little bit interproximally. I hope you're impressed with the strength of this whole porcelain system at this point, because I've been putting some pressure on some of these areas, and I'm not being shy about it at all because I know that once they are strongly bonded to enamel, then she's got lots of strength to deal with.